Well, first of all, you can't pick one healthcare provider over a patient in the whole equation. And what we've got to do is create a system that reimburses fairly, that allows consumers to be involved in their healthcare decisions, including Medicare patients. If we do that, we think we can reduce rates and get an accurate reimbursement for what it costs plus for these physicians. And we do that not by heaping more regulation or more government on the problem, but by introducing ways that we can reduce the overall cost of healthcare, health information technology, by applying what we know are good common sense business practices for not only healthcare providers, but third-party payers as well. And if we implement something across the whole spectrum of healthcare that is private sector generated, private sector managed, we're going to get better outcomes at cheaper prices. I think that's one of the best ways we can do that and take care of physicians along the way. I think nothing should be off the table when we look at healthcare. And again, our problem is that we have taken the consumer out of the healthcare equation. And we need to get the consumers back in. We ought to look at that plan. We ought to look at every plan where consumers start making healthcare decisions before the doctor and the third-party payers all get together to talk about what care was provided. We don't do that in any other sector of our economy. We probably shouldn't do it in healthcare either. And what we've got to do is get that consumer back engaged. If it's because they own the whole plan and the employer has nothing to do with it, something we ought to talk about. Maybe that's the right way to go, maybe it's not. Maybe expansion of health security accounts is the way to do it, so that the new generation of Americans coming up understand that it's my health, my money, I'm going to manage it in a way that makes me have a good, healthy outcome. And if we can instill that kind of a notion in what healthcare means, we're going to get to a better place if it's the employer doing it or if it's the consumer running that particular healthcare plan. We're going to be in a better place. Right now, people are saying it's so hard, it's so difficult, that we're just going to have to let the government take over healthcare in America. And that's the wrong answer. And one of the reasons you talk about McCain's healthcare plan is it's not just one component. There are a lot of components to it, because if you're going to get to a better place in a private system, you have to fix a little bit of everything. You have to have health information technology. You have to have better outcomes and more transparency. You have to have consumers making choices. Do I go for everything, or do I make good decisions about my health care when I know the cost? I have something to do with the cost of it. All of those things have to be done in healthcare to get us to a better place. When it's very easy for the other team to get up and say, it's so hard, everybody should have health care and the government's going to pay for it, it's free. Well, we all know it's not free, and it's never going to be free, and the countries that have it have immense problems that go with it. And so I think it's really going to be in the hands of providers and doctors and people who are engaged in the healthcare profession to stand up and say, wait a minute, we can have a better outcome without the government picking your doctor, telling your kids when and when they can't go to the doctor, telling you how much you can spend every year and you can't spend a penny more, so they're going to ration health care. That's what comes with a government-run system. We can avoid that by having good, healthy dialogue about what is a better outcome and why the private sector can do it far better than the government can ever hope to do.